mul- oh, I'll start again. Dr. Chulani is a cisgender, queer, multicultural settler, clinician, author, educator, and advocate. He serves as Section Chief of Adolescent Medicine at Phoenix Children's Hospital and Medical Director of Phoenix Children's Gender Support Services. He is also Associate Professor of Pediatrics in the Department of Children's Health, University of Arizona College of Medicine, Phoenix. He's completed his pediatric residency training at Menominee Medical Center in Brooklyn, New York, his fellowship in adolescent medicine at Children's Hospital, Los Angeles, and his master's in education from the University of Southern California. His primary areas of interest include adolescent sexual and reproductive health, the care of gay, lesbian, bisexual, transgender, and questioning youth, health equity promotion and diversity and inclusion. He is a member of the Society for Adolescent Health and Medicine's Diversity Committee and serves as co-author for the organization's positions promoting equity and reducing health disparities among racially, ethnically diverse adolescents, 2013, and racism and its harmful effects on non-dominant racial, ethnic youth and youth-serving providers, a call to action for organizational change, 2018. He delivers lectures and workshops nationally and internationally, and he is the recipient of numerous awards recognizing his contributions to adolescent health. He's led and participated in numerous local, state, and national curriculum development, program development, and quality improvement initiatives to provide adolescent-centered care. Again, we're really honored and thankful that you've accepted our invitation to participate in our event this evening. I'm looking forward to your presentation, and as I mentioned, I'm so thankful for everything that I've learned from you, and I look forward to learning more this evening. And so with that, I will turn it on over to Dr. Chulani.
Wonderful. Thank you very much, Holly. So let me see if I can share my screen and we will start from here. How's my audio? Can you hear me okay? Guys, can you hear me okay?
Not sure if you could see our thumbs up, but we can hear your audio good.
Oh, gotcha. Bear with me. I'm trying to adjust my screen where I see you as well while I have my slides showing, but that's not the way it is right now. Can you see my slides?
No, no slides popping up right now.
Bear with me, yeah. All right, what about now?
That is good.
Wonderful, wonderful. So first of all, thanks for having me. And I just want to acknowledge, first of all, the topic for this evening's talk is really how we eliminate disparities and advance equity for our two-spirit LGBTQ communities. And I have to share with you that as a, my background is in pediatrics, and I work with, as a pediatrician, we work with young people typically under the age of 21. But really over the years, I've developed, most of my work has been working with LGBTQ plus young people, working with really diverse young people. I've done a fair amount of work with the Indian Health Service, with outreach to the Navajo Nation in Window Rock, and I'm presently part of an initiative with sort of the Northwest Pacific Portland, India Health Board around really increasing access to gender affirming care, because we feel that this is important work and we are a community that continues to experience disparities. And really what I hope to do during our time today is just share with you what I feel is my roadmap, what I might propose as a roadmap for how we help our young people thrive, how we help our two-spirit LGBTQ young people thrive. Now, you will find that I will often speak from the perspectives of young people because that's who I work with and that's who I primarily serve. But I think we also, I also think of us and the many different roles we have as adults. We are clinicians, we are providers, we are parents, we are caregivers, we are loved ones. During our talk today, in as much as I will refer to young people, I will also refer to adults, right? As those that are entrusted to caring for young people and seeing them through and making sure that they thrive. Sometimes I like to give my talks a different title. Like, what else might I call it? And if I might give this talk a different title, I would call it From the Inside Out and From Micro to Macro, right? So from the inside out, from micro to macro. And remember that, because I think you will see that, repeated several times during our talk. So, I always liken adolescents to projectiles. They are in air. Based on where they are and the forces, the headwinds and the tailwinds that they face, it will determine where and how they will land. And so I first really got involved caring for LGBTQ plus young people. And by the way, I will use LGBTQ and Two-Spirit LGBTQ interchangeably for the purpose of brevity. I first really got involved in this work working with young people experiencing homelessness. And these were young people who had had difficult experiences in homes and schools and systems, and who in many ways had failed to thrive, right? And a large number of these young people were LGBTQ. And they failed to thrive on many accounts, not because of internal flaws, but because of the headwinds and the tailwinds that they faced while they were in this critical developmental period. And I truly feel that in my work with Phoenix Children's Hospital and working with parents and young people, that if we can meet young people right at their launching point, right as they enter into this stage when they first present with questions about gender and sexual identity, if we can build supportive and affirmative spaces around young people, if we can work to develop youth resilience, at the same time work on the headwinds and the tailwinds that they face, hopefully our young people land in better places, right? So for me, this is truly a youth development agenda. And as somebody who has an interest in public health, I want to impart with you a couple of points that I think that I feel are really critical. First of all, in our collective society, there are material consequences that are attached to the extent that our young people live up or live down to the fullness of their potential. Second, likening adolescents to projectiles, the task is twofold. If our goal is to promote resilience and build equity, the task is twofold. We have to work on the individual and promote individual resilience, but at the same time, we have to modify the environment in favor of youth development, in favor of the positive, right? In favor of positive outcomes. And recognizing that our health is the sum of the health of individuals, families, and communities. And in the spirit of equity, we all do better when we all do better, right? Because we as a society, there is a cost that comes with the neglected. So what do we know about gender and sexual diversity in the United States? First of all, there are limitations to our knowledge of the size of the LGBT community or the Two-Spirit LGBTQ community, because we don't always collect information in our large probability surveys. And that's a problem because, if you don't count, you don't really count until you're counted in health policy and in planning. However, based on what we know from the best available data sources in 2020, about 5.6 or 18 million US adults identified as being part of the community. You will see that in 2016, that number was 4.1% or about 10 million. And we see this across the board in recent trends. What about transgender identification, which is a population that I really work with critically, right? They're very central to my work. About 0.6% or 1.4 million adults identify as transgender, along with about 0.7% of teenagers. Although, of course, the numbers that you get and the percentages you get will differ depending on who you ask and how you ask. And what you will see is in some of these surveys that have been done of teenagers in schools, what we find is that a greater number, an increasing number of young people really describe themselves in non-traditional gender terms. And we see this as well in trends of LGBTQ identification among our students, right? So in this one survey, only about 88% identified as being heterosexual. Now, there are also some visible changes taking place in the LGBTQ community. What you will find is that our young people, millennials born between 1980 to 1998, accounted for almost all the increase in LGBTQ identification over the years, while it remained stable for our older groups. The other thing that we're seeing is that the largest increases in LGBTQ identification is also seen among our racial and ethnic minority groups, especially Asians and Hispanic. With this shift, about 40% of LGBTQ identified adults are now members of racial and ethnic minorities. And these really has there's something very important about this when you take a look at the intersections of gender and sexual stigma and racial and ethnic stigma, right? When you consider the impact of racism in addition to gender diversity. So let's talk first about a little bit about stigma. So, Western philosophies of thought are really organized around binaries of good and bad, and fat and thin, and big and tall. And in binarism, there's a favored dominant pole and a non-favored non-dominant pole, and power flows accordingly, right? And think of stigma as an undesired differentness. And gender and sexual stigma is stigma that is attached to any non-cisgender, non-heterosexual behavior, identity, relationship, or community. And all the millions of LGBTQ plus people that we talked about, they navigate their years of development, and the life course really plays out occurring on a background of stigma. Now we have to recognize intersectionality, that we are multidimensional beings whose identity, who are reflections of the intersection of the many dimensions of our identity, and they impact us in ways that are not merely additive, but they create intricate interactions. So for Black, Indigenous people of color that are also gender and sexual minorities, they may have unique experiences and have to deal with double layers of stigma. LGBTQ people with higher levels of education and who are better off economically have better access to resources. When I work with my LGBTQ plus young people in rural communities, in immigrant communities, where sometimes, right, your location affects your access to resources, affects your access to supports. So really recognizing how these play out, especially in the field of health and in the field of health equity. Now, think of gender and sexual stigma as existing on 3 layers, right? When you think of how you address and how you promote resilience and how you tip things in the favor of equity, you have to take a look at the layers within which stigma operates from the inside out, right? From the inside out. So what's internalized stigma? Internalized stigma refers to the acceptance by members of their stigmatized group about the negative messages about their own abilities, about their own intrinsic worth, what it means to be who they are. I once had a 19-year-old transgender female in my clinic, and I asked her, what do you want to be? And she says, I want to be a school teacher. But I don't really think I can be a school teacher, because which parent would really trust their child with a transgender school teacher? I met a 13-year-old young man who was afraid to come out to his church about his same-sex attractions because he was afraid of what it would mean. And now he would no longer be able to serve at church. So recognize that this internal dimension is critically important, especially in the context of identity development, which is a very important part of adolescence. And recognize that internalized stigma is not only about about low self-esteem. It is more than that. And remember that the most potent oppressor, a weapon of the oppressor, is the mind of the oppressed. And in internalized stigma, you just fail to see yourself for your ability. Your self-concept is limited. Your self-esteem is corrupted. Your self-image is negated. Your self-love is defeated. And remember that our young people will live up or live down to our expectations of them and their expectations of themselves. That's why I say from the inside out. To our young people, liberate the mind, right? Liberate the mind. What were the lyrics of the song from way back, right? I'm having a bit of a flashback. Free your mind and the rest will follow. It really begins with the mind and seeing yourself for agency, seeing yourself for possibility, and developing strategies to not internalize negative messages about your own abilities and intrinsic worth. Now, stigma is also personally enacted. What does personally enacted stigma mean? Personally enacted stigma results when when prejudice or emotional bias or stereotypes, which are assumptions we have of others based on who they are and their identities or behavioral bias, become translated into discrimination or behavioral bias. How does this play out? When you take a look at literature, for example, about the experiences of our gender and sexual diverse children in homes and what this means in terms of their exposure to adverse childhood experiences such as childhood maltreatment, abuse, neglect, studies show that LGBTQ youth are more likely to experience adversity in the home. And even in the same household, LGBT children are at greater risk for abuse than their heterosexual siblings, indicating that they may be targeted by parents for maltreatment. When you take a look at the experiences of our LGBTQ students in our schools and how commonly they experience harassment, and what this means in terms of their vulnerability to assault and to discrimination, especially given the lack of anti-discrimination laws and protections for our students in our schools. When young people don't feel connected in schools, they're more likely to miss school. They're more likely to fare poorer in school, and they're less likely to report thinking about remaining in school or planning beyond school. And we know how important academic development is to the future life course. This is enacted stigma. We see enacted stigma and the higher rates of violence that members of the LGBTQ plus community experience, especially transgender women of color. But recognize that the other layer of stigma is institutionalized. Institutionalized or structural stigma is about the differential access to goods, opportunities, services in society because of who you belong to in the group that you belong to. It is normative. It's just embedded in our institutions, and the issue of health disparities that affect two-spirit LGBTQ populations are not simply generic health differences, but are systematic health inequities that are a result of the historic and present unequal distribution of social, economic, environmental, and political resources. And when you take a look at these social determinants of health and well-being for LGBTQ plus people, these are all rooted in institutionalized stigma. We see it in the rates of poverty. We see it in the rates of educational attainment. We see it in rates of access to post-secondary education. We see it in the lack of discrimination protections in the workplace and what this means if your employment is insecure in terms of access to insurance, access to resources, nutrition, unsafe housing. These are all institutionalized stigma. Now we recognize that gender and sexual stigma also affects young people's health. And how does it affect your health? First of all, by restricting access to social resources and or increase exposure to risk factors. We talked about what does it mean when you don't have the resources for nutrition, for housing. Adverse effects on psychological and physiological functioning. We know that discrimination and bias can result in emotional distress and can affect how your body functions for worse. Allostatic load is really a term for wear and tear on the body. When your body's fight or flight response, when your body is always in crisis, and when your crisis responses are always operating, that's a lot of extra wear and tear that you put on your body. And that extra wear and tear is not a one-time occurrence, it's constant, right? So think of what that means in terms of your well-being, in terms of how your body functions if you're chronically under stress, from the reduced uptake of healthy behaviors and or increased adoption of unhealthy behaviors, either because the lack of ability to cope with difficult experiences and conditions in ways that are adaptive and that aren't hurtful to them, but also by direct physical injury caused by violence. And we see that in the vulnerability to violence that's experienced by members of our community, especially our transgender women of color. I just want to point out that there's such a thing as minority stress, right? Which talks about that fight or flight response that we have. And when it's always on, it takes a toll on your health, right? When you're always in crisis, when you always perceive bias, when you're always on watch. And again, I really emphasize structures and systems, because you go from the inside out, right? From micro to macro, working with the individual, working with a young person, and then building out from there to affect systems and to affect structures. That way it is really the roadmap to advancing equity. Which really takes me now to the heart of my talk, right? So how do we eliminate disparities? And I talked about doing it from the inside out. I talked about doing it from a micro to macro. So let's talk about what this means in terms of our micro level work. What does micro level work mean? Well, this is really about the work that we bring to individuals and families. And this looks differently. This is different for a parent. This is different for a therapist. This is different for a physician. This is different for a teacher, educator. But think about the many ways that you interact and touch LGBTQ plus young people. And as an adult, so first of all, I really emphasize, by the way, the constructs of accountability and responsibility, right? Whose responsibility is it to ensure that we secure the best conditions for our young people to thrive? It's the responsibility of adults in society. When we leave our young people alone and when we don't tend to the structures and systems that affect our young people, that is a dereliction of duty. That is a dereliction and an abandonment of our duty to young people. And it's also a breach of our social contract with young people. So besides helping young people be resilient and how we, in the many ways we touch youth, build youth resilience, we cannot just expect youth to be resilient so they can put up with the same crap in structures and systems. That's not what we want them to be resilient for, right? So really thinking from the inside out. So, I've done a lot of writing and speaking really around what I feel is the best approach and the optimal approach in our work with young people in the many ways that we touch young people. And it is an approach that I describe as being affirmative, culturally humble, it is trauma-informed, and it's strength-based. And let's go through each of these. So first of all, what does it mean to be affirmative? Affirmative approaches really emphasize that coming to identify as something than cisgender and straight, that coming to identify as two-spirit and LGBTQ is an equally positive outcome of adolescent development and identity development, as is a cisgender and straight identity, that our young people are no less, that they are no less, right? And that we actively take steps to affirm young people, that we view this as an equally positive outcome. The approach also has to be culturally humble. And of course, this is a group that's familiar with context of cultural humility. But what does it really mean to be culturally humble? One, that we make no assumptions. Our patients are the experts. Our young people are the experts at their strengths and at their symptoms. And when we approach them with open-endedness and we approach them with curiosity. But especially these last two, the second two, is really paying attention to the power dimension. How we show up as equals, how we show up on equal footing. And we cannot show up on equal footing unless we do a self-check in the context of that encounter and be mindful, right? How we come together as equals. But really, what does it mean in terms of also being able to develop partnerships with other groups that are working to advance equality? Because I may be able to create an equal environment with you in my one-on-one, but you will step out of the environment that I'm with you to step out in a world of inequity. And part of helping young people show up and us show up as equals as young people is really striving to negate that imbalance and striving to eliminate that imbalance. We don't really use the word structural humility a lot. I think we use the word sort of cultural humility. If we learn something from the movement of the 1960s for federally funded health centers, to the women's health movement of the 1970s, to the AIDS activism in the 1980s in the face of the relative silence of the Reagan administration about HIV/AIDS ravaging our community, is that members of groups that have been historically and disproportionately impacted by social inequities and disease, they can mobilize. that they can be empowered, that they can partner with systems, that they can form coalitions, that they can inform change, that they can lead change. When we work with Two-Spirit LGBTQ plus young people, we should strive for approaches that really engage and empower youth in ways that are authentic and genuine, right? And that's part of how we also approach them as equals, so that we view them for agency and we view them with the ability and wisdom that they bring that can help transform the systems that impact them. The approach has to be trauma informed. What does it mean to be trauma informed? Well, these are the principles of trauma informed care. We need to create safe spaces. As caring adults, create safe spaces with young people. Really be collaborative and emphasize mutuality and empower young people and really recognize voice and choice. But at the same time, part of being trauma informed has to be being mindful of historical trauma, right? And intersections of historical trauma and how we as a community bear the burden of historical trauma from the murder of Matthew Shepard to the silence and relative apathy in the face of HIV/AIDS, to the continuing violence that's experienced by members of our community. And I know historical trauma is really a term that rings through to our indigenous siblings, to our indigenous brethren, and really recognize how we create safe spaces. As a physician, I can tell you how I've worked to create spaces with my young people. So we have a family advisory council in our clinic. And so they've really guided us, like, hey, like, what are things we can do to create a safe space and to communicate safe spaces? They got us pride t-shirts. We have amazing family members that have little craft projects where each new patient in our clinic, they get these little stones that say you matter. They get pronoun pins. For Christmas, we have a transgender themed Christmas tree with one of my patients posted this on Instagram saying my doctor's office is the best. Think about the ways that you might be able to communicate being a safe space for young people. And this is something that I've really sort of, incorporated in my work with young people. And I've written a little bit about this, about how in the different ways we touch young people, ask them, what does it mean to be you? What does it mean to be gender diverse? What does it mean to be spirit? What sort of messages have you received about being two-spirit? And what are some strategies you do to prevent yourself from internalizing negative messages? And not assuming, right? And really how we just explore with young people, who are you and what are your experiences? How does this show up in school? How does this affect your interactions? And just get to know, because unless you ask, you won't get a chance to know the kinds of experiences that young people are having, especially identity-based trauma related to who you are. In our different tasks in the different ways we touch young people, assess how they're doing. Because young people will have to find ways to cope. And I always tell young people, you can only cope in the ways you know how, and you learn ways to cope through life experience. When I work with a 13-year-old, I know I have a third patient that's working with the life experience of a 13-year-old. He might impress me with his ability to cope in ways wise beyond his years, but that's not a developmentally appropriate expectation. As caregiving adults, as providers, we should be keeping an eye on how our young people our young people are dealing with the things that they have to deal with. And remember that our young people will have to cope in ways that are adaptive, hopefully effective, and hopefully enough. Because when your coping mechanisms are overwhelmed, that's when cracks begin to show, right? That's when we begin to see impact on well-being and mental health diagnosis. And really recognizing that coping too is a learned experience. What does this mean for us, parents and caregivers that care for young people and care about young people? Keep an eye out on your young people and talk about how they're coping. It doesn't have to be secretive, but just monitor and then have conversations. What does it mean for young people? Learning coping strategies, knowing when to ask for help. Knowing when to ask your help is a big skill that young people have to learn. When I work with teenagers, And many of my teenagers are going to be adults. And oftentimes they come to me with history of mental health concerns and mental health conditions. And oftentimes at different points of working together, at different points in their gender journey and gender affirmation, at some point, they will stop their care. Oh, I just stopped it. I stopped my medications. I stopped seeing my therapist. I'm like, sure, that's good because you started something doesn't mean to say you can't ever stop it. But at the same time, in life, you don't ask if you don't get if you don't ask, right? It's really about it being a good judge of what do I need to cope and how well am I coping and how might I do better and to be able to seek out the supports and resources that you need in order to cope well is really the message for young people, because you have to view this as two pieces, right? What can we do as caregiving adults, but what can young people do in and of themselves is really assessing their coping. So one of the things that I've really done over the years is do a deep dive of the literature. What does the literature say about how we can help build resilience and how we can help build equity? Again, to a large extent from the inside out. And I already made the sort of reference to the projectile, right? Remember, we talked about modifying the environment, but we also have to work on the individual and how we bolster individual resilience in the individual. So how do we do that? First of all, promoting a positive self-concept, how you help young people feel good about who they are. And, in some of the qualitative studies, youth really describe seeing themselves. In fact, I love youth words. One of the words that they said, do not have to conceal their sexual orientation and gender identity behind something or someone, to believe in natural sexual diversity and to resist stereotypes of what it is to be masculine or feminine. This is really about finding pride. This is what pride is, right? If you can take the very characteristic that cause other people to stigmatize you, that cause you to be othered, and if you can find pride in what causes you to be marginalized, that, my friends, is resilience, right? So it's really how we foster positive self-concepts and give young people affirmations and what it means for young people too, right? Two pieces. What can we do as caregivers and socializing adults? Help our young people develop a positive sense of self. And that's how you begin to break down internalized stigma, internalized transphobia, internalized heterosexism, but by really actively targeting it. But what does it mean for young people? Recognize when the scripts that you play to yourself are negating and self-defacing and put you down rather than build you up. Recognize when the scripts aren't helpful and tape over those scripts and begin to develop new scripts that will help you begin to challenge internalized messages is a key part of this. Fostering supports. What does this mean? So young people really describe the ability to find others, the ability to make connections. And I would like to think this rainbow gathering is really part of that theme. As caregivers, we can connect young people with peers, with programs, with supportive adults, with mentors, the kinds of supports that we know can and make a difference in their life trajectories. So for us as parents, really building those supports, be it peer, be it adult, be it mentorship, be it programs. And what does it mean for young people? Learning and seeking out the supports that you feel would be helpful. Keeping an open mind and really actively seeking out supports which can be gateways for young people for social connections and for support. Now, what does this look like for me in my work as a clinician? So, I have amazing conversations with parents and children. They come to me, we've probably worked with about 1,500 young people in the last 6 years, and they come to us with very different places in their gender journeys, very different places in their sexual journeys. Lots of times they come to me because they came out to their doctor and their doctor referred them to me, which somehow I feel like, why are you here? Like the fact that you were sent here, are we pathologizing diverse gender and sexual identities? But at the same time, it is such an opportunity to have conversations with an expert about how do you communicate and how do you connect? tell me a little bit about, are you have you come out to your family? How can I be a resource to your family as a way to promote communication and honesty in relationships? What are your fears about coming out? Do you want me to help you come out? When they come out, having parents really talk about what it means for their child, because sometimes our children fear the worst and our parents don't necessarily say to children. And it's during my visit, I'm like, well, how did you take it when your child came out to you? I'm like, well, I still love my child. I'm like, say that again, because your child needs to hear it. I force these responses because oftentimes these things go unsaid in relationships. They go unsaid in families, and our young people need to hear it. I really provide families with resources about how you can support your child. What are some community resources for you as a parent? Because my job is to not only support young people, it's also how we support parents to better support young people, right? And working with them to address school concerns. We know how important school is to the future life course. Many of our patients this morning, my young person is going to switch to online school, and he did so poorly last year when COVID forced him to go online, but he has no choice because of the negative and hostile climate he is getting as a transgender male in his rural Arizona school. And his mom said, if online doesn't work, he's just going to get his GED and then go to Yavapai. Why does he have to get his GED? Because school can't get it right. So really thinking about how we can empower our patients, how we can empower our families to address school concerns when school concerns are identified, how we connect young people with gay-straight alliances as portals for support and alliances in school, how we connect them with mentors, which has been shown to improve graduation rates for our LGBTQ plus kids. Get to know resources. And I have tons of resources, by the way, in these topics on our website. What's another way we can promote resilience in young people? Helping our young people practice self-care, right? How we as caring adults model self-care for our young people, because we need to model these behaviors for young people. And we can really helping young people figure out, how do you breathe? How do you relax? Mindfulness. How do you get it off your chest? What do you do to exhale? Right? And sometimes it includes knowing when to tune out, knowing when to unplug from social media, practicing making sure you get good sleep, and really engaging in good self-care, which we know, I'm a big Audre Lorde fan, and in Audre Lorde's word, right, self-care is not indulgence. It is an act of resistance, because for us to be able to be present and for us to be able to keep on the work that we are doing, we ourselves have to practice self-care in the different worlds in which we trust youth. And for me, self-care really includes making gender-affirming hormone therapy accessible to gender-diverse young people. From the continuum of blocking puberty when puberty does not feel appropriate, walking them through gender-affirming hormones and connecting them with the supports and resources which will help them reach their transition goals, be it social, medical, surgical, legal, because there are many dimensions to transition, and really helping young people through different aspects of transition to me is part of self-care. But really also how we promote youth empowerment, engagement, and activism. And young people describe this as resilience. How we help young people recognize their strengths, their agency, their possibilities, their paths. How we help them connect with alliances, coalitions, and partnerships with other oppressed groups as part of a strategy that recognizes intersectionality, right? That rather than horizontal approaches of trans lives matter and Black lives matter and Me Too, how we strive for horizontal approaches in our efforts for intersectional justice, right? And intersectional equity, and how we partner with others. Because even if we eliminated racism, if we didn't address gender disparities, if we didn't address gender and sexual stigma, we would still have inequities. It's really about how we derive intersectional approaches beyond individual approaches, and how we strengthen young people and how we promote youth resilience is the meso, right? What does the meso mean? This is the level of organizations and institutions. And I just shared with you some of how I've managed to sort of work with our institution and transform it. But this really implies how we begin to break down structural stigma and how we must be proactive and join together at local, regional, and national levels to really come together and address the structural problems at that intermediate level. And lastly, at the macro level, and the macro level is really in the domain of our large systems, right? And how we inform public policy. And in macro systems, we truly have to tackle and address brokenness in the educational system, in the child welfare system, in the juvenile justice system, in the school to prison pipeline, because we know that these are critical social determinants and they critically affect the developmental trajectories of our LGBTQ plus, of our Two-Spirit and LGBTQ plus young people. Macro level change really implies making sure that in the domain of public policy, our elected leaders and our government must uphold our commitment to justice and equity and respect for humanity, and we must reflect this in policy. We have to exercise our civic duty in a way that upholds pluralism, advances equity, and honors our commitment to our young people that we have a social contract with them to secure for themselves the best conditions for them to thrive. Anything less than which is a dereliction of duty. To close, we are all interconnected and our lives and our fates are intertwined, and we all do better when we all do better.